Good afternoon, everyone. It's about 1:30. We're in the 9 News newsroom. I am joined now by Dr. Coley, who has been answering probably about 50 million questions over the last few days. Thanks so much for joining us. We haven't done this in a couple of days.
Right.
But this is really your opportunity to ask us questions, ask her questions, because I'm just the dopey journalist. She's the smart one over here. And go ahead and ask questions. We try to keep these things as light as possible under the circumstances. We know we're talking about a very heavy subject, so if you have some anecdotal stories about what's going on in your neighborhood as you are isolating yourselves from the rest of society, go ahead and share that with everyone. But also, this is your opportunity to ask questions of Dr. Coley. Because of that, you're going to see me looking down at my phone quite a bit. I'm not trying to be rude. I'm just trying to sort of get some more questions asked of you. First of all, I want to get your reaction. There has been some news today here locally. Governor Polis had a press conference to talk about, not a lot about the medical aspect of it, although that certainly was brought up, but really the economic aspect of this and trying to bring some help because, as we now know, a lot of restaurants, bars, other places that have in-house facilities that people come into to dine in, those are now going to be closed to the end of next month. So he's talking about how do we get short-term relief to a lot of people. We're going to have updates on that at 4 and 5. I want to get your thoughts on a lot of states around the country are now taking that additional step to sort of essentially close everything off. What's the benefit of that?
I mean, I think certainly the downsides of that are the economic and psychological impacts, but the benefit of that is that it's actually quite effective from what we've seen in China at reducing the spread of the virus. Because what we're doing right now, I would call it kind of half social distancing, where we have closed down large public gatherings, concerts, events and things like that, but a lot of us are still going to work, a lot of us are still kind of going about our lives as usual. So the benefit of this shelter in place is really extreme social distancing, which can flatten that curve more aggressively. And that's much more effective when you're on the steep part of that curve. So California, New York, all of those places, the cases are multiplying much quicker because they're on that steep part of that curve with that exponential spread that we talked about.
When do you expect, if we're doing this effectively, by isolating ourselves, closing down businesses, closing down common areas for people to talk to, when, in an ideal world, when will we start to see the results of that in terms of caseload?
So if we're doing it effectively, we should start to see it within a few days. The problem is testing. And if we're not testing, we don't really have our finger on the pulse of what the cases are doing. And to me, that's a little bit of the problem. We're not looking, so we're not finding more and more cases. So we don't know if we're doing it effectively, which is why we have to assume the worst, that we're not doing it effectively and really do those aggressive types of measures.
Because you just don't know until that. That's what's so interesting is that what you do now pays dividends later on down the road.
Well, and that's a really good point, Chris, because by definition in a pandemic, you're 4 or 5 days behind. So in order to get ahead of it, you really have to do those aggressive measures. And so I would not be surprised if we instituted that here in Colorado. In fact, I think it might actually help us really gain back control, because then we could actually try to take 2 steps ahead of the virus rather than chasing our tail and being responsive to what it does.
Connie, is Colorado a mandatory confinement right now? What you've seen over the last couple of days is what's still in place now. The schools are closed. Lots of businesses are telling people to work from home. Bars and restaurants essentially closed. What was in place yesterday remains in place today. I'm having a bad time finding my Plaquenil for my lupus. Is this because of the crisis? There's been some shortages of some medications, have there not?
There have been. There are about 20 medications that the FDA say are directly sourced from China or have ingredients that are sourced from China. But Plaquenil is hydroxychloroquine. That's the medicine that President Trump was talking about yesterday.
This is why I need a doctor here.
So I wonder if that has something to do with it, because that was the one that he had said maybe, in FDA trials or maybe FDA approved. But I would look hard, because that's an important medicine that you need to take for your lupus, and I wouldn't interrupt that, if it's possible.
Susie, can we accurately predict how many cases are here in Colorado given the slow test result rate? Is there a general, what was interesting, I'll start this off by the president and CEO of Vail Health 2 days ago went online and said it was his belief in the Vail area. Now, he can't confirm this because there's roughly a few dozen cases up in the Vail Valley right now, but it was his belief that there's hundreds, if not thousands, of cases in that Vail Valley, in the Vail Valley right now. Is there any way to extrapolate what we've seen right now from test results to what we think may be taking place on the ground?
We just can't, unfortunately, because we don't know how many tests we've missed and how many we're not doing. I would agree with what he said, which is that probably there's several hundred to thousand more than what we realize, because look at the other states around us that are testing more. I mean, they have thousands of cases, New York, California, and as I said earlier, they're a little ahead of us on the time curve, and so we could be getting there, but we certainly have more than 200 and something cases that we reported today.
Joanne asked something I find really interesting, because I've been talking about this all morning. If we use social distancing and then relax it, won't the virus just resurge? Won't we see a resurgence of the virus? There's that possibility, is there not?
There's that. That's the great question. So we've gone from containment of the virus, where our goals are not to eliminate it completely like we did with the SARS virus, to mitigation, which means to flatten that curve, to use our medical resources appropriately, to have fewer people infected. But this is a well-known phenomena that as soon as you finish the social distancing and then you go back to your life, you do expect a little bump again. But it's not that big peak. You see two little mounds rather than one big peak. So that's an expected occurrence that would happen once we relax this, yeah.
If you had to visit a hospital in the last few days, should you self-quarantine?
That's an interesting question. I think that depends on your degree of exposure and your contacts, but to be extremely conservative, it wouldn't be a bad idea for 14 days.
We're sort of, the mindset really right now is, I'm hearing more frustration, Arian, about you can't find testing. I have a doctor's note, but nowhere to go. I mean, that's a classic example of what's taking place right now. And the assumption, you hear this, the state put out a release yesterday. If you are sick and you don't have a test, your assumption has to be
that you have it.
You have it.
Yeah. And I would just echo that I'm frustrated too, as a healthcare provider, that I can't order tests on my patients. I can't know what's happening with this, because that limits our ability to understand the behavior of the virus on a global level. But I want to be clear that not getting a test for you as an individual doesn't affect you so much, because it's not going to change really how we treat you or your prognosis or anything like that. So it's less important at an individual level to have a test. It's more important on a global population level to understand what the virus is doing.
Here's a question we ask every time, but I'm curious if it's changing. Are we learning more? How long does it linger in the air, and how long does it last on a surface? Are we learning any more about what the virus does when it's out and about?
We are. There was a New England Journal of Medicine article that came out earlier this week that looked at exactly those questions. So on surfaces, we found that on cardboard it lives for 24 hours. On plastic, and metal, it can live for up to 3 days, and stainless steel as well. And on copper, it lives for about 4 hours. Now, this study was very interesting and actually got a lot of attention, because it was the first study to demonstrate that there may be some ability of this virus to be airborne. So up until now, we've been talking about droplet precautions, which means direct contact with respiratory secretions less than 6 feet that would transmit this virus. But in this particular study, they actually aerosolized the particles into the air with a high velocity. So they made small particles and they put them in the air with a high velocity. And what they found is that it could linger in the air for up to 3 hours like a fog.
Right. That's why I was at, when gyms were still open, my gym had a fan on, and a doctor had visited and said, you don't probably want to you want to turn the fan off. Is that probably because there's just that worry that it is aerosolized and it can be in
Exactly. And the worry really occurs also in the healthcare setting. And we've been hearing a lot about our healthcare workers not having the personal protective equipment. But if they're doing medical procedures, they're giving breathing treatments to these patients, that's when that aerosolization can also occur.
Have you seen study out of China about blood types and susceptibility to virus? Type A more susceptible and type O less susceptible. Hasn't been peer reviewed. Any thoughts on that?
Yeah, I have seen that study, and I don't put a lot of stock in it right now, to be honest, for a couple of reasons. Number one, blood type A was more common in China, in the population that was studied. So because blood type A was more common, people that got the infection were more likely to be blood type A. Second, because it's a homogeneous population and it's a small sample size, and as you pointed out, it's not peer reviewed, we're not clear whether this is an association or a causation. In other words, does having blood blood type A make you more susceptible to the virus, or is blood type A just a marker for something else, some other behavior or some other immune thing that then makes you more susceptible to the virus?
Is it, because isn't the fact that this is a novel coronavirus, so we're still learning a lot of things about what it's going to do.
We are learning. We're sort of like working with something with the blindfold on, and sometimes we have the luxury of 5-10 years of data. In this case, we're talking about weeks or months of data to guide us.
Cindy, this is interesting because I've heard other people suggest that. Cindy asks, is it possible to have had this virus in January? I had a really nasty respiratory illness that started in December. I know a lot of other people got it. I had a cough that lasted for probably 3 months.
Here in the United States?
Yeah.
So possible, especially if you've traveled, because that was when we were really talking about direct contact, but probably unlikely, because if it was here in the United States, we would have seen that exponential spread occurring a lot sooner.
And I mean, there was just there was some nasty, just like
Other
every winter,
stuff,
there's just lots of nasty things that go on.
Bronchitis and things like that, yeah.
Hey, so this is great. Mike says, this is great. I just want to mention that Dr. Coley has been consistently brilliant throughout this crisis. I appreciate her calm demeanor and informative answer to questions.
Thank you, Mike.
We have to find reasons to smile.
Yes, you made me smile.
Why is non-essential retail still open? You've got older folks mingling with kids running around in home decor stores. I mean, this is a concern of yours, that we still have a lot of intermingling taking place.
It's a huge concern. And I think, like I said, half social distancing does not work, particularly when you get on the steep part of that curve. So I worry that we're headed for the same fate as California and New York if we don't start to really, really buckle down and make sure that we're not doing unessential things outside the house.
Jennifer, I'll answer this directly. Please post resources, financial help, resources for people who can't work from home, like hairdressers and barbers. This has been very difficult. It was a big news that was announced yesterday to sort of expand it by the governor. We're having a story on that later on tonight on 9 News. And also, if anybody wants to share a personal story that maybe they think should be on the news right now, we are taking loads of stories. There's most of the time we can't interview people in person because of what's going on right now. It's led to tremendous change that is a whole other story what's going on in newsrooms across the country. But if you have a story you want to share, I have a really simple email address right now. It's chris@9news.com, CHRIS @9news.com. I want to hear from as many people as possible. Tell me what's going on the ground. Tell me what stories you believe are not being covered right now. Tell me what stories you think we're overemphasizing. This is really a time for you to sort of open up. If there's criticisms you want to direct at our newsroom, by all means, send it to chris@9news.com. My wife was tested. This is from Ken. My wife was tested Tuesday, but she wasn't told how she would be notified of the results. Email, mail, call, do you know? I think most of what I'm hearing is phone calls.
Is it? Yeah.
So there was Daphne Michelson-Janae, is a representative with the state of Colorado, Democrat. She was tested on Tuesday, and she got her results yesterday. She went through. I asked her how she got so fast, and she said her testing was done by UC Health. And I don't know if they've streamlined their system, but she got her test results back in 2 days. She was positive. She said she was notified by the county yesterday morning via phone call. I'm assuming a lot of those are sort of coming via phone call. Even some of the negatives are coming via phone call as well. Orthodontic offices, are they considered non-essential?
Yes, yeah. And especially because you're in the mouth of kids or adults who may be asymptomatic carriers.
Sherry, are there some people who will contact the virus but not ever get sick?
Yes, there are some percentage of people who never really mount that immune response that leads to those systemic symptoms. So they'll have the virus, they'll be infectious and at risk to other people, but they won't themselves get sick.
I think what's interesting is that some of the things we're learning are actually more concerning for younger ages.
Yeah.
It's not just like this is, anybody who tells you that this is a disease for 70 and 80-year-olds, first of all, what kind of a person goes around saying, oh, it's okay if people in their 70s, 80s. My mother's in her 80s. Like, I'm going to take that personal. But at the same time, this is not just a disease of 70 and 80-year-olds. This is a disease we're finding. Most people who are hospitalized in the state of Colorado right now are not in their 70s.
Yeah, and actually the CDC just released a report 2 days ago giving basically what has happened in the United States over the past 5 weeks. And doctors were alarmed to see some of these findings because what we found was that 38% of hospital admissions were people under 65. 48% of ICU admissions were people under 65, and 20% of deaths were people under 65.
Something interesting, too, that came out in the press conference this morning, that males are more susceptible than females.
Well,
do you have any idea why?
So I'm going to put a little caveat on that one,
Good.
because in China they saw that maybe men had a slightly higher risk of infection, but that was also confounded by the fact that men smoke more in China, and there are significantly more older men in China. So it's hard to know whether it has a gender predisposition. It's certainly been raised before. In babies, we saw the opposite, of course, in a very small clinical trial, but babies less than 1 year of age, 7 out of 9 of them were female. So I don't think we can hang our hat on a gender predisposition yet, but it's certainly being investigated.
Leslie, why aren't they closing daycares? That's a really tricky question, because you still have parents that are, there are still some parents that are working. I mean, we have loads of people who are going to be determined to be essential. Even if the governor does make an additional decision to essentially shut the state down, there's loads of professions that are considered to be essential workers, grocery store workers among them. I mean, how are we going to sort of exist in a world where people who have to go to work to get a paycheck, they have kids, they need daycares? Like, how do we sort of find the solution here? Well, these are really difficult
This is a tough question, Chris. Yeah, but I think daycares are a source of infection. And, it's a little different from the flu, because the kids themselves don't get sick like they do with the flu, but they're going to bring it home to mom and dad and grandma and next door neighbor and everybody else. So I am concerned that we're still having daycares, but I don't have a good answer as to what the alternative would be if we were to close them down.
Why isn't the National Guard or people from military bases helping with needed supplies or medical personnel right now? Rian, I think you're going to see that.
I hope we do. And I know President Trump promised us that he is invoking some of that under national order, but I'm concerned also that it's not coming fast enough.
I apologize, because I've gone down the list and I don't see the name of the person that asked this, but it popped in mind, this question of, like, why don't we just shut everything down? Literally, everything down for 2 weeks. And if it only lives for 14 days, then you can get an idea that this is gone.
Yeah. So that's the theory behind the whole social distancing and behind shelter in place. Of course, we can't shut 100% of things down, because the people that are sick now need doctors, they need hospitals, and those doctors are going in and out of the hospitals, and we need our food and our water, our electricity. So that's, in theory, that's the idea of social distancing, and that's the idea of this extreme social distancing called shelter in place. But it's just not practical to shut 100% of things down at this time.
Ray, is there any news on the jails? Have they been infected yet? You would think it would start to pick up in there. I know there's a lot of worry in jails because of
close quarters. And
And I think obviously counties and sheriff's departments going to have to big decisions on their hands with that. Also, we saw yesterday a home health care facility in Colorado Springs that had 6 positive cases. I think those are the fears that within a vulnerable population, close quarters, like, are just some of those stories going to be unavoidable right now?
They are, and what worries me about them is that you create there's mini epicenters, so to speak, of the virus, where then the spread gets even more accelerated and that curve gets even steeper in those types of situations. And home health care, nursing homes, as we've seen in Washington, are really concerning, because those patients are also most likely to die from them.
I think, are you good? You have a 145, don't you? So I'm going to have to let you go.
Yeah.
I could carry this on forever. But thank you so much. I know there's lots of questions. I know lots of people have lots of questions. Again, we'll try to do this as often as possible, but thank you, Dr. Coley, for joining us.
Thank you.
And thank you, everyone, for joining us. Stay safe. Keep distance. Social distancing is the word of 2020. And again, if anybody has any story ideas for me, chris@9news.com. Thanks so much for joining us. And I totally need to let you go. So thank you.